for Brexpiprazole, Rexulti with professional level pharmacology detail. This version is suitable for medical, pharmacy, or nursing students and healthcare professionals. Brexpiprazole Rexulti, complete drug monograph. 1. Generic name, drug class, brand name, and drug forms. Parameter description. Generic name, Brexpiprazole. Drug class, atypical antipsychotic, serotonin dopamine activity modulator, brand name Rexulti. Chemical class, quinoline derivative, molecular formula C25H27N3O2S. Dosage forms, oral tablets, 0.25 milligrams, 0.5 milligrams, 1 milligrams, 2 milligrams, 3 milligrams, 4 milligrams. Manufacturer, Otsuka Pharmaceutical Co. and Lundbeck. 2. Definition, Brexpiprazole is an atypical second-generation antipsychotic designed as a serotonin dopamine activity modulator. It is used for schizophrenia treatment, adjunctive therapy in major depressive disorder, MDD. It is structurally related to aripiprazole, but exhibits less intrinsic D2 receptor activity, potentially reducing akathisia and agitation. Brexpiprazole acts by stabilizing neurotransmission of dopamine and serotonin, improving symptoms of psychosis and mood instability. Chapter 3. Mechanism of action. Brexpiprazole exerts a balanced modulation of dopamine and serotonin receptors, which leads to both antipsychotic and antidepressant effects. Receptor, activity, functional effect. Dopamine D2, partial agonist, reduces positive symptoms of schizophrenia, stabilizes mood. Serotonin 5-HT1A, partial agonist, anxiolytic and antidepressant effects. Serotonin 5-HT2A, antagonist, reduces extrapyramidal symptoms and improves sleep mood. Adrenergic AF1B and AF2C, antagonist, reduces agitation and cognitive disturbances. Histamine H1, weak affinity, minimal sedation and weight gain compared to other antipsychotics. Overall effect. Brexpiprazole stabilizes dopamine and serotonin signaling, improving both positive and negative symptoms of schizophrenia and enhancing antidepressant response. 4. Pharmacokinetics, parameter. Description, absorption, well absorbed orally, not affected by food. Bioavailability, 95%. Time to peak, Tmax, 4 hours post-dose. Protein binding, 99%, mainly to albumin. Volume of distribution, 1.56 the kilogram. Metabolism, primarily hepatic via SY3A4 and CYD6 enzymes. Active metabolites, yes, DM3411, minor contribution. Elimination half-life, 91 hours, prolonged steady state, once daily dosing feasible. Excretion, 25% in urine, unchanged plus metabolites, 46% in feces. Steady state achievement, approximately after 10 to 12 days of daily dosing. 5. Therapeutic uses. Schizophrenia reduces hallucinations, delusions, thought disorder. Adjunctive treatment of major depressive disorder, MDD, enhances response to antidepressants, e.g. SSRIs, SNRIs. 6. Indications. FDA approved. 1. Schizophrenia, adults. 2. Major depressive disorder, MDD, as adjunct to antidepressant therapy. Investigational, off-label, under study. Agitation associated with Alzheimer's dementia. Bipolar disorder. 7. Contraindications. Known hypersensitivity to Brexpiprazole or any component of the formulation. Elderly patients with dementia-related psychosis associated with increased risk of death. Caution in severe hepatic impairment. Reduced metabolism increases toxicity risk. Caution, history of seizures, cardiovascular disease, or diabetes mellitus. 8. Precautions before taking this medicine. Discuss with healthcare provider if you have diabetes or risk factors. Drug may elevate glucose, cardiovascular disease or low blood pressure, seizure disorders or head injury, liver or kidney impairment may alter drug clearance, history of suicidal ideation or mood instability, pregnancy/lactation, use only if benefits outweigh risks, children, not approved under 18 years. Black box warnings, critical. 1. Increased mortality in elderly patients with dementia-related psychosis. 2. Suicidal thoughts and behaviors in children, adolescents, and young adults with depression. 9. How to use. Route. Oral, once daily. Administration, with or without food. Consistency, take at the same time daily for stable plasma levels. Do not crush or chew tablets. Continue taking even if you feel well. Do not discontinue without medical supervision. #10 Dosing information. A. Schizophrenia adults. Initial 1 milligrams per day, days 1 to 4. Titration 2 milligrams day, days 5 to 7. Maintenance 2 to 4 milligrams day. Maximum 4 milligrams day. Note, Dose adjustments required for CYP2D6 poor metabolizers and when using CYP3A4 CYP2D6 inhibitors or inducers. B. Major depressive disorder adjunct. Initial 0.5 milligram per day, target 2 milligrams per day, maximum 3 milligrams day. Dose adjustments, situation, adjustment, CYP3A4 inhibitors, e.g. ketoconazole, dose by half, C2D6 inhibitors, e.g. fluoxetine, dose by half. CYP3A4 inducers, e.g. carbamazepine, rifampin, dose may double. Number 11. Missed dose, overdose, missed dose. Take as soon as remembered. Skip if near the next scheduled dose. Do not double doses. Overdose. Symptoms: sedation, vomiting, agitation, tremors, confusion, tachycardia or seizures. Treatment: supportive care, airway protection, symptomatic management. No specific antidote available. Activated charcoal may be used if within 1 hour of ingestion. NAR 12. When to stop or avoid taking. Stop immediately and contact physician if you develop fever, muscle rigidity, confusion, sweating, possible neuroleptic malignant syndrome, NMS. You experience involuntary facial tongue movements, possible tardive dyskinesia. Avoid alcohol or sedative drugs, enhance CNS depression. Avoid abrupt discontinuation, may cause relapse or withdrawal symptoms. 13 side effects. Common to 5%. Akathisia, restlessness, weight gain, headache, somnolence or fatigue, dizziness, nausea or constipation, increased appetite. Less common serious, neuroleptic malignant syndrome, NMS, hyperthermia, rigidity, altered consciousness, tardive dyskinesia, involuntary movements may be irreversible, hyperglycemia, diabetes mellitus, orthostatic hypotension, seizures, leukopenia, neutropenia, suicidal ideation in young adults, dyslipidemia. Vital monitoring parameters. Monitor routinely, parameter frequency reason AMI, weight AMI baseline and periodically, fasting glucose HbA1c baseline and periodically, lipid profile baseline and periodically, blood pressure, each visit CBC. If patient has low WBC history, EPS-TD symptoms, regularly AIM scale, mood and suicidality, especially during first few months. 15. Drug-drug interactions. CYP450 interactions, type, examples, effect. CYP3A4 inhibitors, ketoconazole, clarithromycin, Brexpiprazole levels, reduced dose. CYP2D6 inhibitors, fluoxetine, paroxetine, quinidine, Brexpiprazole levels, reduced dose. CYP3A4 inducers, rifampin, carbamazepine, phenytoin, Brexpiprazole levels. Other interactions, category, interaction, alcohol and CNS depressants, additive CNS depression, drowsiness, antihypertensives, additive hypotensive effects. Anti-diabetic drugs may alter glucose control. Levodopa or dopamine agonists may antagonize dopaminergic effects. QT prolonging agents, use cautiously, though Brexpiprazole has low QT risk. Number 16, summary table feature details, drug name Brexpiprazole, class atypical antipsychotic, mechanism, partial agonist at D25HT1A, antagonist at 5HT2A, I1B, I2C, half-life 91 hours. Use schizophrenia, adjunct MDD. Common ADRs, akathisia, weight gain, somnolence. Serious ADRs, NMS, TD, suicidality, contraindicated, dementia-related psychosis. Metabolism, CY3A4, CYP2D6. Pregnancy category, use only if benefits outweigh risks. Thank you. Have a nice day.